Hey, what's up, everybody, and welcome back to another episode of Goat Talk Smiles. I'm Dr. Valenzuela, your host for today, and today we'll be talking about something that I hear a lot from parents. Doctor, they're just baby teeth, right? And honestly, I get it. They're tiny teeth. They fall out eventually. Kids are growing fast. But here's the thing. Baby teeth matter way more than what most people realize. And today I want to explain why these little baby teeth play a major role in your child's development, confidence, health, sleep, speech, nutrition, and even how their adult smiles develop later on in life. So if you're a parent, a future parent, or someone that works with kids, then this episode is for you. So let's get into it. A big misconception is, well, they'll fall out eventually, so cavities and baby teeth aren't such a huge deal. But imagine this. Your child has pain every time they eat, gets an infection, can't sleep because of toothache, or avoids smiling, loses teeth too early. That affects them now, 9 years from now. But baby teeth are temporary, yes, but they have permanent effects on growth and development. Think of baby teeth as natural placeholders or guides. They guide healthy permanent teeth into position, chewing abilities, speech patterns, jaw development, facial growth. And when baby teeth are lost too early because of a cavity or an infection, that can create a domino effect later on in life. A lot of parents don't realize that baby teeth help children learn to speak correctly or properly. Baby teeth help with sounds like F, S, the. When baby teeth are missing too early, kids can develop speech difficulties or compensations. Now, that doesn't mean that every child with missing teeth is going to need speech therapy, but baby teeth absolutely play a role in proper oral development and tongue positioning. This is especially important during those early years of development when the brain is learning speech patterns rapidly. Another big reason why baby teeth matter, kids need them to eat properly. Yes, this sounds obvious, but think about it. If chewing hurts because of a cavity or infection, kids often avoid meats, fruits, vegetables, hard, healthy foods. And instead, they may prefer softer, processed foods because they're easier to chew. So oral health can directly affect nutrition. Now, that's not just a baby tooth problem, but that's quality of life. This is something I'm really passionate about as a airway focused pediatric dentist. Mouth breathing, enlarged tonsils, poor tongue posture, cavities, infections, narrow, small jaws, it cannot connect to poor sleep, snoring, difficulty concentrating, behavior issues, growth concerns. A child who isn't sleeping well may look hyperactivity, irritable, emotional dysregulation, trouble focusing in school. And the parent may think it may be ADHD. But occasionally the child simply isn't breathing or sleeping optimally. And so oral health is connected to whole body health. And this is why early dental visits are very important. We're not just checking for cavities, we're evaluating airway, patterns, habits, growth, development, tongue function, spacing, and breathing patterns. There's so much more happening than just teeth. A cavity on a baby tooth is not just a cavity. If left untreated, that cavity gets bigger, deeper into the tooth, and eventually can create an abscess, swelling, an infection, pain, difficulty sleeping, ER visits. And remember, the adult tooth is developing right underneath the baby tooth. So, severe infections can sometimes affect the developing tooth below. That's why prevention is so important. The best dentistry is prevention, helping families avoid trauma, pain, fear, costly treatment. That's our goal. So if there's one thing I want you guys to remember from this episode, it's this: baby teeth are small, but their impact is big. They help children sleep, eat, speak, grow, smile, develop confidence, guide healthy adult teeth. And so taking care of them early can truly change a child's future. If you're listening and your child hasn't seen a dentist yet, the American Academy of Pediatric Dentistry recommends a first visit by age 1 or within 6 months of the first tooth erupting. And remember, small, consistent habits matter. So, brushing twice a day, flossing regularly, reducing frequent snacking, regular dental visits, encouraging healthy sleeping and breathing habits. Those little things add up over time. Thank you so much for listening to another episode of Goat Talk Smiles. I'm Dr. Valenzuela. I'm really excited for all the future topics we're going to cover together. If this episode helped you, please share it with another parent, repost it, leave a comment below, and stay tuned for the next episode.